In 1998, an article was published in The Lancet by Dr. Andrew Wakefield claiming that there was a link between the measles, mumps, rubella vaccine and autism. That's since been found to be fraudulent because, one, the author fudged some of the data. There were patients with medical histories which were changed in order to be accepted into the study. There were conflicts of interest, and the data has never been shown to be substantiated. There's been a number of studies around the world, epidemiological studies, which have found no link between the MMR vaccine and autism. In Japan, they stopped the MMR vaccine and went to a single measles vaccine, and they found that autism rates actually went up after the vaccine. The fact is that the signs of autism appear in a child at about the time of the MMR vaccine, so there might be some coincidental timing that people then believe is related to the MMR vaccine. Vaccination has enabled a number of diseases around the world which are quite fatal to be prevented. And the damage done by that article has meant that vaccination rates dropped in a number of countries around the world. And this meant that the required vaccination rate in the population, say around 95% of the population, was not reached, which meant that you couldn't get this herd immunity effect of vaccination. Herd immunity basically means that even if you have not been vaccinated yourself, you're protected because the virus or the bacteria can't live in the population because there's a set number of people who are vaccinated, and therefore the organism can't live in the population and can't move around and spread to infect others, and so you don't get cases of the disease. And this has been the case with measles, polio, and whooping cough and a number of other diseases. It's quite understandable that you can't have 100% vaccination rates in developed countries, and the reason for that is there are people who do have reactions to vaccines, and that is not something you can predict or prevent. And so if at least 95 to 99% of the population is vaccinated against the disease, then you can get this herd immunity phenomenon happening, which leads to protection of people who can't get vaccinated through either for medical reasons or perhaps religious reasons, and they can be protected, and the population overall is protected from the diseases. It's a really sad thing that paper led to a distrust by parents of vaccines and how good they actually are as a healthcare tool to prevent diseases in their precious children. And so imagine you're sitting on a plane, as people were when they flew from Brisbane to Auckland in January, and just by sitting next to someone or near someone who was not vaccinated against measles, you happen to contract the disease. And this is exactly what happened to a number of people. And the crazy thing about it is that there's a completely preventable situation if everyone was getting vaccinated against the disease. Vaccination is definitely the best thing, but I understand that there are a number of people in the community, particularly parents, who fear for their children's health and well-being, and vaccination is perhaps seen as a scary thing by some parents. And so I think what we really need to do is get education out there about what vaccines actually are, how they work, that they are pretty safe in general, and that they lead to prevention of a number of diseases which can cause death or permanent impairment in kids and adults. I don't like the idea of having a runny nose and conjunctivitis and rashes all over the body, and it's got a 0.3% fatality rate as well, so no, you don't want something like that. Whooping cough is another classic example of a disease which has increased because of decreases in vaccination rates, and here you have babies dying of whooping cough, and there is no reason why that should be happening.